Bleeding during pregnancy. Many women experience vaginal bleeding at some point in their pregnancy, especially in the first trimester when the pregnancy is just beginning. In many cases this can be completely normal. How to stop vaginal bleeding during pregnancy? 1. Keep track of the bleeding. It is very important to have an idea about the amount of blood loss during an episode of bleeding. This will help your doctor to make a possible diagnosis as well as establish a management plan. Start monitoring the amount of blood you are losing as soon as you notice the bleeding. 2. Get plenty of bed rest. For minor bleeding in early pregnancy, rest is the ideal treatment. Physicians usually advocate complete bed rest for the first few days following the episode of bleeding. 3. Avoid heavy work. Your physician will definitely advise you to avoid strenuous or heavy work such as weightlifting, climbing stairs frequently, running, cycling, etc. These activities cause jerking of the uterus and can rupture the delicate, nulliform blood vessels in the placenta. Avoidance of these kind of activities is absolutely necessary, even if you only notice a tiny amount of bleeding. 4. Put intercourse on hold for the time being. Sometimes intercourse can induce or aggravate bleeding from the vagina. If you experience bleeding during pregnancy, you should avoid intercourse until your doctor tells you it is safe. Normally, you will have to wait at least 2 to 4 weeks after bleeding has stopped. 5. Do not use tampons or try to douche. Do not insert anything into the vagina following vaginal bleeding. Absolutely avoid using tampons or douching, as these may injure the cervix or vaginal wall causing further bleeding. Douching may also introduce bacteria and other microorganisms into the vagina, leading to serious infection. 6. Stay hydrated. It is very important that you drink adequate amounts of fluid during a bleeding episode. This is particularly true if you have experienced severe bleeding.